Hello, I'm Jerry Laws, the editor of Occupational Health and Safety magazine. Welcome everyone to this 1-hour live presentation, which is titled 3 Tips for Adding Audiometric Hearing Testing to Your Service Practice. It is sponsored by SHOEBOX Audiometry. Our speakers are Dr. Mark Freeman and Alexa Goff. Dr. Freeman is an occupational medical specialist and the founder and medical director of Mobile Medical Solutions in Broussard, Louisiana. Dr. Freeman uses SHOEBOX Audiometry to perform his mobile hearing testing. Alexa is the business unit manager for occupational hearing conservation at SHOEBOX Audiometry. She works with some of the most forward-thinking manufacturers and on-site or near-site occupational healthcare providers in North America. Today, in a roundtable-style webinar, they will share insights into how to get started offering audiometric testing as a service. You can submit a question for our presenters at any time during the presentation, and I will moderate a Q&A session during the final minutes of the hour. If you experience technical difficulties, click on the Help button located below the slide window, and you will receive technical assistance. Finally, after the session is complete, we will be emailing you a link to the archived version of this webinar so you can view it again or share it with your colleagues. And now, I'll turn it over to Alexa Goff.
Welcome, everyone. Thank you for joining us today. Today, what we're going to be looking at is why you might be considering adding audiometric testing to your services business, as well as what to look for in the testing equipment, because there are options, and not all options might be the best for your business. And finally, we're going to look at how adding audiometry can help grow your business in ways you might not have expected. So today I'm sharing the floor with Dr. Freeman. Dr. Freeman's got a bit of a cold today, so he's sticking it out. So bear with us as we work our way through this presentation. And without further ado, we're going to jump right into our conversation. So I would like to start by asking Dr. Freeman to tell us a little bit about his business, Mobile Medical Solutions. So Dr. Freeman, the floor is yours. Please tell us a little bit about your business.
Well, good afternoon, Alexa, and thank you. Mobile Medical Solutions is actually a division of a larger umbrella company called Access Medical Solutions. And we've actually found through surveys and queries of our clients that really people have or want and actually need better access. And so one of the means by which our occupational medicine business started providing access or more convenient access is to start a mobile medical company. And so we started Mobile Medical Solutions, whereby we provide these occupational health services on site and soon to be through telemedical instrumentation online. So we're really excited about the Mobile Medical Solutions Company, and we've been well received in the community.
That's wonderful. So it sounds like you've taken, you've identified an obvious need for on-site or near-site testing services. And I know that you work across several different industries, but there seems to be a focus on the energy sector. Is that accurate? Are there other industries that you have quite a large presence within?
No, I think you're accurate in saying that we are basically engrossed in the energy sector, which comprises upstream, downstream, and midstream. And just to be simple, the upstream is that division that obtains the energy resources, such as the oil and gas. The downstream is that which utilizes those resources to convert into products of use, like the petrochemical industry, to make plastics and things. And the midstream is just getting it to and from one place to the other with pipelines and trucking or transportation industry. So yes, our focus has been mainly the energy industry, but it's not our only. We can serve, all other industries requiring the OSHA-regulated medical surveillance exams.
Well, that's perfect. You actually created the perfect lead-in to my next question. So the next question I have for you, Dr. Freeman, is why? Why offer occupational hearing testing? I mean, there's so many different types of testing that are regulated by different regulatory bodies. Why focus on occupational hearing testing?
Well, that's a good question, but in our field, it's one of the necessities. It's a requirement in certain of the regulatory compliance agencies such that companies provide a standard environment in which to work for which they cannot have noise levels above certain quantities, or they will have to engage in some sort of hearing conservation program. So OSHA has some regulations and guidelines that protects the employees' hearing of many companies throughout the energy industry, and there's service companies as well. So, for instance, if somebody was in a manufacturing company, or if somebody was outdoors in a sandblasting company, or if somebody was outdoors on an oil rig, the different environments require certain protection. And in order to better protect the employee, you have to have some gold standards. So OSHA has these regulations by which you test the hearing of the employees on a regular basis upon employment, and then annually thereafter, and then upon change of environment of the job description or workplace, if you will. And so these are requirements that many of the companies that we deal with and the clients that we serve have as standard laws or rules and regulations and requirements by OSHA. And so this is one of the needs of the industry to provide audiometric testing.
Absolutely, absolutely. I think you've summarized that quite nicely. So if we've established that, the customers that you're servicing have this OSHA-regulated requirement to not only establish a baseline audiogram, but then continue to test their employees on an annual basis, and of course report on those findings to meet certain regulatory compliance standards. I guess the next obvious question here would be, let's talk about how. We've covered why, let's talk about how. So I'd like to ask you, Dr. Freeman, about how you perhaps had been offering audiometric testing as a service before you discovered SHOEBOX. Was it in a clinic only? Did you ever go onto your customer sites before using SHOEBOX? Talk to me about some of the limitations of, traditional methods of testing, whether it be sound booth or otherwise.
Great question. Absolutely, Alexa. So back in the day, we used to all have audio booths in our clinics, and the company clients would send their employees to our brick-and-mortar clinics, and you'd have to wait in line for each employee to go into a booth, be tested, get the results, come out, and it was a long time affair. And then, that being said, we also had to have, expensive booths brought in, calibrated, with expensive maintenance and upkeep. And if you wanted to increase your efficiency, you would get more than one booth, and these booths are not inexpensive. They're quite expensive and somewhat detailed to keep up and maintain and calibrate it, but it was necessary, and so that was a necessary evil. And then we were able to provide more convenience for our clients by becoming more mobile and going on site, but that entailed or required to have a booth installed into a mobile trailer, and then you got to have some sound effects in that trailer, and then you have to have a truck to pull the trailer, and you have to have employees with special insurance to operate the truck and the truck. It was a hassle, but it was a necessary evil as well. until which time we developed Mobile Medical Solutions, and I was doing some research, and we came across SHOEBOX Audiometry. Well, the greatest thing since sliced bread was their jingle when I heard "Think Outside of the Booth." Oh, my gosh, because that's exactly what I was doing.
So, Dr. Freeman, let me just stop you there for a minute before we move on to the next topic, which is, the future of your business. I just wanted to reiterate because, there's many people on the call today that are at the point where they're making a decision about, how to provide this service to their customers, this, audiometric testing as a service. And the mobile unit really has been, for quite some time, the standard way to deliver it. But I think that it's not, like you say, insignificant in terms of a financial investment, because obviously it's more than just an audiometer that we're considering here. We're actually looking at, the sound booth, plus the trailer to carry the booth, plus the truck to take the trailer, and then you've got your consumables, so your gas, insurance, and things like that. So I think it is an important point to touch on is, considering all factors that play a role in that calculation when you're looking at, which option would be best suited to your business, particularly if, for example, you're a new or a smaller business looking to add audiometric testing, and perhaps you hadn't been previously. So this would be a net new investment. So that's a great point. Now, I'm moving on now. As you mentioned just a minute ago, you now offer mobile services, which is wonderful. So can you talk to me a bit about when this change came about, maybe how you found us? How did you find SHOEBOX Audiometry? And then, how that's changed the way that you're able to now deliver this type of service to your customers, your clients?
Yes, ma'am. Well, great question, because we had a brick and mortar facility as well as did everyone else. And then how we stood out among the crowd to provide more efficient means of service, we thought about going on site. So we had to be mobile. And so that was well received in our industrial community on site. And then we decided to look at all of our needs, our stocking and staffing of our equipment and our manpower, and wanted to get the most portable equipment that we could find at the best available price. Well, when researching all of the portable equipment, actually, I just did a Google search on portable audiometric equipment, and it came up, and it was like the light that Edison saw in his head before he did the light bulb. It was when they showed that jingle, "Think Outside the Booth," I think that would just, lit a fire in me, because I think outside the box a lot.
That's right.
When I heard that, I said, I got to look more into this. And actually, that's when I got introduced to SHOEBOX Audiometry and learned of all of their benefits and their features.
Amazing. That's wonderful. And, you're just the type of forward-thinking and innovative business that I think that, the system was designed for. Like you say, it sets you apart from, comparable service providers that are maybe more tied to traditional methods. And, like I say, again, it does alleviate that need to have, this expensive equipment, the sound booth and the truck, which makes sense in certain situations, but in others maybe adds an unnecessary expense. So, when we're talking about audiometric testing for, occupational purposes or environments, obviously front of mind for everyone is regulatory compliance. I mean, I know that myself, I often field questions from my customers about how SHOEBOX meets the OSHA requirements or ANSI requirements, particularly because we are enabling our clients, so service providers like yourself, to test outside of a sound booth. And I'm sure that you probably have received questions as well from your clients. So I know what my answers are, but I'd love to hear, how, you field that question when you receive it from your clients. If you have ever been asked by your clients about regulatory compliance. I mean, SHOEBOX is quite a departure from what many would be used to their audiometric testing. So, change can be scary. And like I say, regulatory compliance has to be the first concern. So can you speak to me a little bit about how you've handled the regulatory questions, if any?
Absolutely, Alexa. There's, like you said, resistance to change, especially in the traditional sense in the oil and gas or the energy industry. But when you present a change that is more efficient, which means the simplest definition of which is the greatest return on your investment, these companies are open-minded, eyebrows raised, and ears ready to listen. So when you can provide them with the equipment that meets regulatory compliance, and this is part of our research. We wanted to make sure that all the North American, Canadian, and American regulatory agencies, by recommendations from ANSI and regulations from OSHA, this equipment and this testing procedure meets all of those requirements. And actually, the research says it not only they have tremendous results that say they go above and beyond, and there's even preset OSHA required settings on the machinery themselves that our technicians utilize with ease.
Absolutely.
So to answer the questions, yes, absolutely. We receive those questions, and it certainly does meet all of the regulatory compliance. And people have been, the companies have been very pleased, very pleased.
Wonderful. Well, I'm glad to hear that. I think one thing, that we can provide from our end, that we try to do at least, we have a team here that is solely dedicated to regulatory compliance. So one thing that, we can assist with from this end, as you mentioned, was having, preset configured OSHA tests right out of the box to eliminate any guesswork. Have those OSHA requirements pre-established so that right out of the box, the system is ready to be used, and once the test administrator has been, efficiently trained, we then, in addition to the training, provide, preset configurations for tests that meet the OSHA requirements. So that's great. Moving on now, I think what I would like to really look at, because now you've had the chance to use the system out in the field. You were obviously a leader in your state and your region to, one of the early adopters of this new technology, and, really set yourself apart from others in this regard. So I would love to hear how this has, or using SHOEBOX in this method has changed your business. And particularly, I'm very much interested in learning how it's been used to offer new services such as the OG UK and DOT tests.
Very good. Well, actually, this has been very efficient in a means by which we could make this mobile medical company work, that is cost effective, because this is one of these stop blocks, if you will, on companies providing on-site services or mobile services, and the expense that we've already gone over with the trucks and trailers and booths and things. So coming across SHOEBOX Audio and being forward-thinking and being one of the first adopters of this technology in Louisiana, which is the part of the mecca of the oil and gas industry, that in Texas, but we were really able to capture a audience and capture a means by which to deliver efficient services to that audience because of this uniqueness in the audiometric testing, which is a requirement, as we said before. So we were one of the first to offer new services, and then we utilize this and in many aspects, some of which as a backup for DOT exams. DOT exams were Department of Transportation medical surveillance exams, which are standardized exams that tests hearing on all of their drivers, but mainly through the forced whispered test. But if a driver doesn't pass a forced whispered test, then it's a requirement for them to get an audiometry test performed, and they, in order to qualify to drive a commercial motor vehicle, as well as another exam which requires audiometry, not the forced whisper test, is the OGUK. And OGUK is a certain medical surveillance exam that's for employees who work in the oil and gas industry. If they work for a company that was based in the United Kingdom, or do they work in the United Kingdom, or they work on a rig that is owned by a company headquartered in the United Kingdom. In any case, it's a type of physical exam that requires audiometry as part of their pre-quals or qualifications. And although a lot of companies in the United States do not require it, they are actually leaning towards that type of exam. And unless you have capabilities to provide audiometric testing, you're not going to be able to provide these specialized oil and gas medical surveillance exams. Well, SHOEBOX Audiometry allows for that special requirement. Plus, the equipment is so easy to use with this pre-configured OSHA prerequisites, and the time it takes to train the staff to do it, it just frees up a lot of time for the medical provider.
Perfect. So you've been able to train other members of your team to conduct these tests with SHOEBOX.
Yes, ma'am. And with the help of the SHOEBOX personnel, help training us all, so that it relieves me of all of the time required in order to administer these tests. My technicians can go out and about in a hub and spoke type manner and provide these testing for multiple clients at the same time. And it's a very efficient means of providing a service.
Wonderful. Well, the next topic I would really like to speak to you about, because this is the really exciting piece of the future for your business. Is this the new online capabilities that you are moving towards? I am so interested in your new or in the idea of offering online services. I'm hoping that you could tell us a bit more about those, how you're bringing occupational telemedicine to the forefront, bringing telemedics into the field, performing your testing. Can you speak to me about what the next phase of your business looks like?
Yes, great question. Thank you, Alexa, for allowing me to explain what we're trying to do. Is I think everybody has recognized that telemedicine is the future of our medicine, especially in the primary care industry, and it deals in the public with the ability to provide a doctor-patient encounters from a distance. But that hasn't been really addressed in the private sector or in the what we call the occupational sector, which deals with the companies for their employees, as opposed to the general public, which they have a choice to go see whatever doctor they want and use whatever insurance they want. Employees for a particular company have to go to where the company contracts with the doctor. All that being said, it's the private sector as opposed to the public sector. So telemedicine is being utilized in the public sector now in teledermatology, teleradiology, mental health, and things of that sort. But we are going to be the first to bring the telemedicine concept and provisions of services to the occupational field. And what I mean by that is the telemedicine, it requires real-time audiovisual communication with a medical provider from a distance. And so you have to have a presenter, which encounters the patient physically, and then a medical provider at a distance somewhere that can actually hear and see what is going on. And so my experience being in the military, I was a corpsman with the Marine Corps, and we were trained to go out in the field and provide medical services. And so that actually led me to say, why can't we train advanced scope healthcare providers to go out in the field to utilize the special software and hardware that is being touted in telemedicine as sufficient for or equivalent to a face-to-face consultation, and present that case or that medical surveillance exam or whatever the case may be to the provider in real-time audiovisual communication from a distance, and still be able to elicit a diagnosis, a medical decision, and a treatment plan, and take care of business from a distance. So actually, we are bringing telemedicine to the occupational health industry, utilizing the energy industry right now, which will be forefront medicine. And we're utilizing the efficiencies of delivery of SHOEBOX Audiometry to help us with this engagement.
That's perfect. So if I could just summarize then and separate, look at the benefits both for not only the employers, which obviously, you're bringing a convenience factor and also comprehensive reporting, to cover all of your liability or regulatory issues. For the employees, though, you're also creating an enjoyable experience, when it comes to some of these required tests that they have to complete while working in, certain industries like the energy sector. So it's really a win-win here, or even a win-win-win when we consider all three parties involved. What I would like to do, if you wouldn't mind, is look at an example of one of your current customers. And that customer is Schilling Distributing Company in Lafayette. So, maybe we can take everything that you've said today and apply that to one, tangible example of how you're using this new technology to really offer, state-of-the-art, cutting-edge, technology, but offering, really, industry-leading level of service to your customers. Can you speak to me a little bit about Schilling and how you provide services to this company in particular?
You bet, Alexa. Listen, Schilling is a great company. Tremendous people from the top down and bottom up. These guys are really open to providing anything and everything they can to help better their employees' healthcare and health program benefits. So Schilling was one of our clients that was reaching out for something more efficient. First off, they were sending their employees to a brick and mortar clinic miles away from their location. Second off, they were paying whatever the going rate was at the time, which is probably not their first interest. Third, they were having not as good as in reporting and or communication as they needed in order to get their employee out in the field. And fourth, there was liability with time away from work, and that's the biggest thing. They had to send their people out. Well, we engaged with them and asked them what was their biggest concerns, and money happened to be not their biggest concern. They were willing to pay to play, but their biggest concern was was time away from work. And employees, when they had to leave that job and get in the traffic and to go to and wait on and then come back from a brick and mortar facility, it was just cost prohibitive. And they couldn't see that they had any other choice. Well, now we've given them another choice. We've been able to save them from their employees leaving their company by us coming on site. We've been able to save them the money required in order to not just travel, but to pay for the service, because we gave them, we came underneath the budget. And then we were able to provide quality services for them on site with immediate communication. We were there and everybody was communicating in real time instead of storing forward or waiting on faxes to come through or whatnot. We gave them timely reporting, and there was no real liabilities because there was no lost time away from work. One, they didn't have to send 5 employees at a time and wait for hours. They could actually, the employees could continue their work schedules until it's time they were called in for their medical surveillance exam. So we started out with DOT exams with Schilling, because they're a distributing company and they have a lot of truck drivers operating commercial motor vehicles. And so there's certain requirements with the DOT, as we said earlier, one of which is the forced whispered test. And if you don't pass that, you have to have available to a means by which to give an audiometric test. Well, we weren't hauling booths around, especially since we came across SHOEBOX Audio, which was perfect for us because we always have it available. And then if we need to, we could do the testing right there on site. And so it just became part of our efficiency package to deliver our services, which is all about efficiency. So Schilling was very excited and ecstatic, and they're one of our first clients, and they're one of our biggest clients, and they're an awesome company to work with. And now, because of the efficiency of services that we provide and results that they have obtained, they're interested in us taking a look at their entire employee health program, from the top to bottom and bottom to top.
That's wonderful. It sounds like, you found a like-minded customer in that you're both open to change and moving forward with the advancements in technology. So that's wonderful. Continuing in that vein, as we get to the end of the half hour we have here, I guess I want to give you the opportunity, Dr. Freeman, to ask any final questions that you have for me. I know that one that we had discussed previously was, what are the possibilities of, future integrations with other telemedicine software. I'll speak to that one first, and if you do have others, happy to answer those. I know we are going to open up the floor to other questions as well from the group. But just, so I can cover this one off for you, integrations is a topic that I have to speak to on almost a daily basis. And my go-to answer is, the beauty of a software-based audiometer is that anything is possible. So, our product continually iterates. In fact, every 45 days the system is updated. And our development team is actually, it's quite a large development team, and they're dedicated 100% of their time to this product. So usually every 4 months or so, there's significant new feature releases. But I would say the best part of this system is that the product grows and evolves based on feedback from our customers. So people like you, Dr. Freeman, who have been so helpful in providing feedback on what you need to be able to make the most of this system. So our product roadmap in terms of adding new integrations or adding new features is directly correlated to what our customers need and want from us. So, what that does is really guarantee that our product will meet our customers' needs now, but also as we go forward in the future. So, I'll leave you with that. I'm not going to commit to specifics in terms of, specific pieces of software, but I can tell you that, once we do provide specific integrations, it will be as a result of what our customers need and what they're looking for.
Very good, Alexa. That was actually one of my questions in the past, and for any in the future, because of the new integration of telemedicine into certain fields of medicine, there's going to be different software companies that's going to be entertaining different occupational health clinics. But I just want everybody to know that because SHOEBOX Audiometry is software-based, cloud-based, software-based program, the interfacing with any and all of the other softwares that you might be exploring to utilize in your occupational health clinics will be easily taken care of. If I could speak to that, is that correct?
Absolutely, absolutely. It's
Yeah.
Certainly, we try to ensure that our systems will integrate seamlessly with, all the other tools that you're using within your business, and fit in nicely with your existing environment. So on that note, I want to allow enough time to cover off the questions that we have from the group. Thank you, Dr. Freeman, for working through that and sharing all of that information with us today. We really appreciate it. And with
You're
that,
very welcome.
At this point, I would like to open the floor up to questions from the group.
Very good. Nice job, both of you. You've done a very good job, I think, of explaining the benefits of portable and on-site audiometric testing. Very, very helpful. And we have a number of good questions that are ready for you. This one's mainly, I think, for you, Alexa, but Dr. Freeman, feel free to chime in on this and others. How portable are the SHOEBOX systems, and how easy is it to transport the systems, and do you provide a travel kit?
Great question. So some of you may be wondering why an audiometer is called SHOEBOX. So the reason for that is quite simple. So our founder, Dr. Matthew Bromwich, decided to, as a result of lugging around booths and clunky equipment for many, many years, let's design something lightweight, portable, mobile. And so we call it SHOEBOX because the audiometer fits in a kit that is quite literally the size of a shoebox. So the kit that comes standard with every audiometer is it's cloth-based, it's lightweight, the iPad, the transducers, all of your cables and equipment, in fact, fit into one handheld kit that is light enough to either transport by vehicle, shipping, even as a carry-on on an airplane. So to answer the question, if you can carry a lunch kit, let's say, you can carry the audiometer, and yes, we do provide all of your travel kit requirements.
Perfect, thank you. Let's see, here's another good one. What specialized equipment, if any, will I need to start testing with SHOEBOX?
Great question. So the SHOEBOX system is configurable in a couple of different ways. So, for example, if you're already using an iPad, the system is iPad specific. However, if you're already using an iPad in your clinics or as part of your business, you're able to use your own, or we can provide it for you. Beyond the iPad, the only other very specialized piece of equipment are the transducers or headphones, and we provide you with those. We also calibrate those. So in terms of the specialized equipment that you would need to provide, there really isn't any because we provide it for you. As we spoke to in quite a bit of detail today, SHOEBOX eliminates the need for a sound booth. So without the sound booth, and with us providing the remainder of the equipment, in terms of your need to provide any other equipment, there is none.
Perfect, thank you. A couple of questions. These are actually for Dr. Freeman for sure. the first one, very straightforward. Dr. Freeman, what do you charge for a test?
Oh, well, that is more in line with my administrative personnel. You caught me with my hands sitting on my hands because I don't really know. I think it's somewhere in the neighborhood of $35, just somewhere between $35 and $55. I think it's close to $35.
Okay, very good. Thank you.
But I can't tell you with any certainty. That's an administrative question.
All right.
But I can tell you all about choledocholithiasis.
Well,
if I could just make one note there, Jerry.
Sure.
I speak to service providers across the continent and actually across the world. And although there are some averages, in terms of what each test costs, oftentimes it will be, regionally specific. So, if you're in, near the Arctic Circle, it's going to be one price. And if you're in, Manhattan, it's going to be a different price. So, I would say that the cost per test or the cost associated with this service will usually be regionally specific or state specific.
That's a great answer. Thank you both. Here's another one, actually, same questioner. I think it's a good one. So do you take SHOEBOX into a factory or business and find a quiet room to perform the testing? Is that how it's done?
Actually, I do. There's I guess the software that is associated with the SHOEBOX has some sort of diminishing ambient noise software so that it's not, a specialized room that you need, but you find a quiet room right in there in the plant or the plant's office or the administration portion, and you can undergo your testing with multiple patients at one time, as a matter of fact.
That's great. Thank you.
I can add to that one as well, just to give you even more context. As Dr. Freeman said, it's fairly flexible. The system is fairly flexible in terms of testing environments. If I were to just give you, an idea of where most of our customers are doing their testing, so most of our service providers who go on site to conduct testing at their customer sites, it's usually a small meeting room. Maybe some of them have, learning rooms, classroom-style rooms. If they do have a medical room, sometimes they'll use that. I would say most importantly, you probably want to set up, though, as close to the workstation or the floor as possible, because that way you're eliminating that travel time as much as possible. So, every second counts when we're talking about pulling people off their workstation to do something like a hearing test. So I think that having the flexibility to set up in a variety of locations but still test in compliant environments is, one of the great features about the system.
That's very good. Thank you. Here's a good follow-up question. What training, someone asks, is required for an occupational health office within a company in order to use SHOEBOX Audiometry?
Sure. I can field that. Yeah, I can field that one. So the first thing I'll say is that we provide training to all of our customers. It's one-on-one. It's customized to your application of the system. So that is scheduled as soon as the system is shipped out. We contact you, schedule a one-on-one session with you and your team members. That session doesn't typically take more than a couple of hours. If you, in addition to that training, you also have the option of completing a KAOC certification course. We work with a large number of KAOC instructors, so I always like to mention KAOC. It's a great program if you do want to complete, I think it's a 20-hour program that you can complete, which will give you a very thorough training in audiometric testing. When using SHOEBOX in automated mode, no specialized training is required. However, the system also offers other types of tests, like manual audiometric testing. And if you are using the system to its full capability with the manual mode automated, you will need to do something like a KAOC program or be a qualified medical professional that understands how to conduct the test manually. So that's in the manual mode. In the automated mode, like I said, above and beyond our training, there really isn't much you need to do. So in terms of turnaround time, we can get you up and running in, very little time, so often a week or 2 weeks at most.
Okay, very good. Thank you. Here's a good one. How do you manage annual calibration for the SHOEBOX system?
Great question. So calibration is included in the cost of the SHOEBOX system, and we manage it proactively for you. So the way that we do that is at approximately, at the 11-month mark, our customer support team contacts you, usually confirms details like shipping addresses and things like that. And at that point, we will ship out. We actually manage our calibration by providing you with new transducers every year. So we'll actually replace the equipment for you on an annual basis. When you receive your new transducers, they will already be calibrated to your system. You'll put the old ones back in the box and ship them back to us. So there's no downtime to you. There's no sending out the system and waiting for weeks to have it calibrated. And there's no added cost for calibration. So we try to make the process as streamlined and as painless for you as possible.
Perfect. Thank you. This one just came in, and Dr. Freeman, I think it's for you. The questioner asks, how long in minutes is an average OSHA test?
Well, and going back to your previous question, our Alexa's answer actually is the manual and the automated. I always use the automated. So in the automated thing, it's about 10 minutes or thereabouts. And so but we can actually field multiple tests at one time with multiple shoeboxes. Alexa, what do you think?
Yeah, I would say that, when we do our, tests, the average that we've seen is about 1 minute per frequency. So with 7 frequencies, you should expect 6 to 8 minutes. That being said,
yes,
you have to factor in maybe a couple of minutes for instruction. So you're going to instruct the patient on how the test works and then begin the test. So, the instruction time plus the test time, obviously there's some variables involved, such as how comfortable the patient is using an iPad and things like that. But I know that from what I've seen when I'm on site with my customers doing tests with their employees, on average, 30 seconds per frequency per ear or a minute per frequency is by and large the average that I've seen for the test. Okay,
very good. Thank you. We've got a couple more. And this one is actually kind of a follow-up to one that you answered earlier, but I think it's a decent question still to ask. Just talking about the types of environments that customers typically use for testing, is it difficult to find spaces that are quiet enough to test in?
Well, let me just point something out, Alexa, real quick. When we go on site, we look for the conference rooms. I mean, just about all of the companies have the conference rooms. And they allow us to utilize the conference rooms. It actually is a quiet environment. It works out just quite nicely. We don't usually have more than 10 or 12 people at one time. And so we look for the conference rooms, and that's worked out quite nicely.
Perfect. Yeah, I think that's great. I certainly, especially if you are testing more than one person at a time, then something like a conference room would be perfect. Like I say, it varies based on the environment that you're testing in. But something like a conference room or a small meeting room, or often they'll have, like I say, these training rooms that work well. It's fairly flexible. I mean, you don't want to be setting up somewhere that is, right in the heart of the lobby and it's high traffic. But, some sort of reasonably quiet environment will do the trick and provide you with a low enough level of ambient noise that you'll still be able to capture valid results.
Okay, very good. Thank you. Here's one more, and I bet this is a really common question, but it's a good one. The questioner writes, can you use previous audiograms gathered with other devices to do baseline analysis with SHOEBOX?
Great question. Yes, absolutely. So the SHOEBOX system really has two main parts The first part is the audiometer, and the second part we have is a full-service suite that allows you to do data management, reporting, employee records management, and that kind of thing. So one of the things that we would cover in your training is how to do things like uploading a patient list or employee list prior to going out and doing your testing, if you have one. And we would also work with you to upload any baseline audiograms that you have. You can do that manually just by inputting values, or you can do that by uploading a spreadsheet of values. So if you have a batch of results that you could upload at once, we would show you how to do that. And it doesn't matter which system was used to gather those results. They can still be used for baseline comparison, shift analysis, and that type of thing, regardless of what system they were gathered with. The thing, I think I mentioned this a little bit earlier in the presentation, but SHOEBOX was designed on an open platform and designed to be used in conjunction with other systems, other tools. So we speak the same language, from a data standpoint as, whether it's Benson or Mako or any of the other, traditional audiometric systems, we all speak the same language, which means that we can understand their data and they can understand ours.
That's a great answer. Thank you so much. That is the end of the questions we've gotten, and I think some very good ones came in, so thank you, everyone. I just want to thank our audience for attending today's webinar, and both of our speakers, Dr. Mark Freeman and Alexa Goff, for just an excellent presentation. And also thank today's sponsor, SHOEBOX Audiometry. Remember, everyone, in the next day or two, we will be emailing you a link to an archived version of this webinar so you can review it or pass it along to your colleagues. Thank you very much for attending, and this concludes today.